Okay. Well, I've had lupus for 20 years, a little over 20 years, supposedly. I started out with, well, basically, you know that old saying, I've got a rare blood disease. I started out with a rare blood disease. Basically, it was a type of anemia. And without getting into too much details, basically my body was attacking itself. And it was attacking its blood. I was very anemic, and they really had no idea what was going on. That's how it started out. I've had, I've had a splenectomy. I've had my spleen taken out to help handle my blood. I had a gallbladder surgery because I was having severe abdominal pains, and they thought I had pancreatitis. They took my gallbladder out, and it actually, what they were trying to handle actually got worse. I was diagnosed with lupus several years ago, which is basically an autoimmune disease. The body attacks itself. And so I've had problems with my kidneys, my blood, sore a lot, swollen, get inflamed easily, tired all the time, that kind of a thing. That's kind of it in a nutshell.
Okay.
You know,
Yeah.
I mean, right now, over the last few months, I've had lupus has what's called a flare-up. It's a common term with people who have lupus or autoimmune diseases, and I've been having a pretty serious flare-up, and I'm losing protein in my kidneys, which eventually would lead to kidney failure, heart problems. I'm very anemic. I have a very high susceptibility to blood clots. I've had a blood clot before. And just a lot of inflammation. I get swollen, I get sore, I'm very tired.
Okay.
Yeah.
That I understand.
Yes.
And what did the doctors say when you saw them?
Oh boy, that's funny. The doctors don't really know what to do. They can treat symptoms. I've had 2 surgeries. Wow. Excuse me.
No rush.
I've had lots of prednisone, which is a steroid, which has a lot of severe side effects in itself, but it actually helped me maintain my blood counts. I've been on blood thinners. I was on a medication that they give it to kidney transplant patients, and basically it knocks out the immune system. And what they do with kidney patients, it allows the kidney to actually be taken into the body and maintained in the body. A lot of times if you put a different body part in somebody's body, the body will reject it, so that medication helps them to keep the kidney going. Anyway, they gave it to me to help my kidney problems that I was having from the lupus. Again, I had my splenectomy. It was basically, I was on a very high amount of steroids for about a year. And the doctor said, listen, every time they try to take me off of it, my blood counts would go down. So they basically said, well, you can have chemotherapy or take your spleen out. So I had my spleen taken out, and that at least, it was kind of an unusual solution. That's all they can really come up with are unusual solutions. They don't really, they don't know how to do it. They're not trained on it. They're trained on how to give medication. It's the whole line of, the pharmaceutical companies really do run the medical community. I know that from 21 years of experience with them. So, but they know how to give medication, they know how to do surgery, and so on and so on and so forth, but they don't know how to resolve problems, and that's why people keep having flare-ups, because nothing's ever resolved. They can suppress it for a while, or give you a medication that will suppress it permanently, but those end up having, like there's a medication they give for lupus that's actually, it's a medication they give to malaria patients. But for some reason it tends to help lupus. But I mean, it gives you an idea. It's nothing, it's a little ridiculous.
Yeah. Like, how does that work?
Well, it's really, I mean, it really is a shame. It's really hard to, the medical community is something that is so, it's an institution in our country. I mean, if you take a look at even history, it's why you call your doctor. Your doctor would come and they would fix you and they would do this and that and the other thing, And there has been a lot of things that have been developed over time that have been able to keep people alive, which are great innovations. And I think that a lot of doctors really care. But it's unfortunate that, and it's evident from speaking to them and asking them questions. I had one doctor, as an example, I had a doctor I was seeing, an immunologist, and he was basically helping with me with my blood stuff and blood clotting and stuff, and I had been reading up some information about vitamin E, and how it actually helped blood clots. And I asked him one day, I said, what about vitamin E? He goes, I don't know anything about vitamin E. So they are, unfortunately, and again, this is not, I don't get on ideologies and just follow along because it makes sense. This is from practical knowledge of seeing these guys for 21 years. They are ingrained with medicine is the only thing that works, period. And so their response to things like herbs and that sort of thing are, well, there's no science behind it. Well, but the actual statement is there's no science behind it that I've actually studied or been allowed to look at.
Right, not allowed to look at.
Because the science is there. Please, give me a break.
Right.
The science not there? What? And I've heard that statement many times on how the science isn't, the science is, now where it's like, well, how do we handle it? That's the PR comeback on how you handle that stuff. They simply aren't trained on how to resolve illnesses.
And if many of them
It's
say
the way
the
it is.
same thing, then it must be educated on that.
Oh, it's totally educated.
So why would they put into the educational system how to
Exactly.
reply to that?
Exactly. Well, go down to Cedars-Sinai. Just go down in the medical building someday. Just sit there in one spot, and you will see drug rep after drug rep after drug rep after drug rep going in and out all day long.
Sad.
That's the information that the doctor has. They're in their practice all day long. And they've got their other studies they have to do. So where are they going to find out about these medications? They're going to find out from these guys. So it's actually a self-perpetuating vicious circle, unfortunately.
Yeah.
So they're not educated on, like, okay,
Other alternative medicine.
and even when there is an herb that does work, it's not allowed into the community until it's been taken to the drug company and some doctor has done, okay, good, I'm going to take my science team and we're going to make this and we're going to get it through the FDA. Now it's okay, so now we can use this herb. And that's why, when you go to you can see these little mom and pops. Ever wonder why these little mom and pop drugstores sit there and they don't do anything except sell drugs? And you never see anybody in there. Well, it's because they market stuff up to 3,000%. It's the whole, again, part of the vicious circle. I mean, I'm getting onto a little bit of a soapbox here, and I'm not trying to, but the situation is what the situation is.
Yeah. Needs to be known. That's putting this on film to
Right.
start educating and letting
Right.
people know there is alternative.
Right.
So.
And it's kind of funny because right before I started seeing Dr. Quang, and this took me, so maybe I'm slow, I don't know, but it took me 20 years to realize that my illness doesn't exist.
What do you mean?
It's lupus It's nothing. It's saying, we're going to give a name to something. We're going to tell you you're sick. We have medications that we can give you that will suppress what's going on. End of story. There is no lupus virus out there. There is no insect that bites you and gives you lupus. You don't kiss somebody and get lupus from them. There are causes for it, obviously. But it's a stupid illness. And then just give a name to something that doesn't mean anything. You have, I mean, you can take a look at the family of autoimmune diseases. And a lot of them have the same symptoms, just different names. Maybe they have a little bit of a different thing, or maybe like Sjogren's syndrome. Well, this guy Sjogren ended up discovering this one little thing. It's a little bit of a twist on the same thing. Crohn's disease. A little bit of a different twist. Affects the stomach more than it does the kidneys or the heart or whatever. Arthritis. Well, where do you go to get tested for arthritis virus? Ain't happening. Completely off the mark on what is actually going on. Because the guys that developed the arthritis medication are on the board here or whatever. They've developed the medications and they've got it approved through the other doctors who are like, yes, this is great. Let's invest in it. We'll make a lot of money, and because everybody's got arthritis now. Or whatever, but basically that's it. Used to be, as an example, it's a perfect example of it. I'm sorry, I'm getting on my soapbox again, but
I understand you have grudges. And
well, it's not even that. It's not even that. It was just like, well, okay, if I'm sick, I'm willing to work, I'm willing to pay for it, I'm willing to do whatever. But after you go 20 years, it's like, well, we can suppress your immune system, we can remove your body parts, we can give you drugs that will literally kill you on the long term. But we're not even going to look to find out what really is going on. That's the only thing that's aggravating. But as an example with the drugs, years and years and decades ago, if you needed pain relief, you would go to your herbologist or whatever and get white willow bark. Well, you can't patent an herb that exists in nature. So what they do is they take that white willow bark and they analyze it. They find out, well, there's this acid in this white willow bark, and that's what kills the pain. So we're going to take that acid and we're going to make it. And we're going to sell it as this drug called aspirin.